Ureter vesical valves. In human anatomy, the ureters are tubes made of smooth muscle fibers that propel urine from the kidneys to the urinary bladder. They are usually 25 to 30 centimeters long and 3 to 4 millimeters in diameter. Basics. In humans, the ureters arise from the renal pelvis on the medial aspect of each kidney before descending towards the bladder on the front of the psoas major muscle. The ureters cross the pelvic brim near the bifurcation of the iliac arteries. This is a common site for the impaction for kidney stones. The black flow of urine is prevented by valves known as the uretrovesical valves. Basics. In females,
ureteral openings. You have the ureters, which goes up down to the urinary bladder. And
you can't find those.
Yeah, you can't find the rest.
No, I can't. You have to go somewhere else.
You go up to the kidneys, which ureters and the renal pelvis. Renal capsules outside, and then renal cortex is outside of the medulla.
You can do this again.
Oh yeah, we did that. Yeah, and then calyx, major calyx, renal pelvis, down to the ureter.
In females, the ureters pass through the mesometrium and under the uterine arteries on the way to the urinary bladder. Disorders. Cancer of the ureters is known as ureteral cancer. A kidney stone can move from the kidney and become lodged inside the ureter, which can block the flow of urine, as well as a sharp cramp in the back side of lower abdomen. There are 3 sites where a kidney stone will commonly become stuck: at the ureteric junction of renal pelvis, as the ureter passes over the iliac vessels, where the ureter enters into the urinary bladder. Clinical. The ureter is sometimes injured during hysterectomies, near the infundibulopelvic ligament or where the ureter courses posterior to the uterine vessels. Blood supply. The ureters receive a segmental arterial supply. From proximal to distal, the ureter is supplied as follows: medially by branches of the following vessels: renal artery, glomerular artery, abdominal aorta, and common iliac artery. Then, laterally by branches of internal iliac artery and its branches, superior vesical artery, uterine artery, only in women, middle rectal artery, vaginal arteries, only in women, and inferior vesical artery, only in men. Ureteral peristalsis. Ureteral trauma. Ureteral injuries due to external trauma are rare. The ureter is well protected in the retroperitoneum by the bony pelvis, psoas muscle, and vertebrae. Damage to the ureter usually results from a significant traumatic event that is almost always associated with collateral injury to other abdominal structures. Etiology of the trauma. The American Association for the Surgery of Trauma has classified ureter injuries. The following is Ureter injury scale, which includes the grade of the injury, type of injury, and the description of this. Grade 1, hematoma, contusion, or hematoma without devascularization. Grade 2, laceration less than 50% transection. Grade 3, laceration 50% or greater transection. Grade 4, laceration complete transection with less than 2 cm of devascularization. And grade 5, laceration avulsion with greater than 2 cm of devascularization.